Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to political scientist Timothy Callahan of the Texas A&M School of Public Health. They discuss the politics of vaccine hesitancy and how to overcome a blue state, red state divide with COVID-19 vaccines. Let's listen.
Timothy Callahan, thanks so much for joining me.
Happy to be here.
So today I want to talk to you. You have sort of a unique position, right? So you have a PhD in political science. You work in health policy. So you're probably the perfect person to ask. Tell me about the role of politics in vaccine hesitancy that we're seeing in the United States.
Yeah, well, it's a really important issue for us to be considering right now, and it's an issue of growing concern. Historically, we have found an association between ideology and vaccine uptake, but before COVID-19, it was a pretty small association. What we're starting to see now, though, is wide disparities in vaccine uptake between conservative members of the American public and liberal members of the American public, and it's a growing concern. It's something we, one, need to understand, and two, we need to try and overcome in order to push us towards those herd immunity numbers we need to get this pandemic over.
So what are, obviously conservatives are less likely to get vaccinated. Where does that come from?
Yeah, so we have now very clear evidence just both at the individual level as well as at a county or state level that conservatives are more unlikely to vaccinate than liberals. Now, we're trying to understand why. It's not just one thing. There's a lot of different factors at play. A lot of it can be traced back to the actions during the early efforts of the Trump administration during the pandemic. The first thing we need to remember is that during the early part of the pandemic, the Trump administration and President Trump himself downplayed the severity of the virus, claiming the virus wasn't very serious. And if you're a conservative co-partisan and you're hearing from your political leader that the virus isn't very serious, well, why would I go and get a brand new vaccine for something that's not very serious and I'm probably not going to get and I'm probably not going to get sick from? Now, that's not an accurate interpretation of it, but that's what many conservatives believed. Furthermore, we're depending on people to trust information from scientists about the safety and effectiveness of the vaccines. But during the Trump administration, President Trump himself, as well as other members of his political party, regularly denigrated scientists, Anthony Fauci and many others, saying, well, they're flip-flopping, they're changing their minds. And if you're telling them, the American people, they need to listen to scientists that these vaccines are safe and effective, while simultaneously saying you can't trust the scientists, it's going to lead to some mixed messaging and some people lacking trust in the safety and the effectiveness of the vaccines. And then recently, we've had sort of a third arm of this, a new potent arm, which is right-wing media. Over the past 6 months or so, we've seen right-wing media outlets, Fox News in particular, but Newsmax and others, and some of their key primetime figures like Tucker Carlson, strongly promoting ideas about questioning vaccines and this as being a government program and sort of sowing doubt further among conservatives. And all this is served to do is while liberals continue to move from being hesitant for one reason or another into vaccinating, we still have a large proportion of conservatives who are hesitant to vaccinate. And that number, that divergence between liberals and conservatives is growing over time.
Does this sort of, deeply held conservatism, is that going to keep us from actually solving this pandemic? I mean, it seems to me that they're really dug in.
It could. I mean, the reality is we're a divided country. We've been a divided country for decades, and that means that we have a large number of conservatives in this country. And if a subset of those conservatives are unwilling to vaccinate and can't identify strategies to get them to vaccinate, we are almost certainly going to stay below that sort of 70 to 90% threshold that many scientists have talked about that we need to get to in order to vaccinate. Now, we've sort of hit 70% vaccinated nationally. The Delta variant is preventing us from seeing some of the benefits of that. But it's critical to recognize that even as it's 70% nationally, we have to worry about it at the state and local level as well, right? Just because we're 70% vaccinated nationally doesn't mean that we're 70% vaccinated in Texas or Arkansas or Louisiana or Alabama. And we need to make sure that in those states with larger proportions of conservatives, that we're also hitting those numbers we need. And this vaccine hesitancy that's developed among some conservatives could certainly prevent us from getting there in the end.
What kind of strategies should we be using to convince Republicans to vaccinate? I know that former President Trump got a vaccine sort of in secret, hasn't come out and said in a really big way, everybody should go out and get vaccinated. Is that something that would be helpful? What kind of strategies?
Yeah, so there's been a little bit of research on this, not as much as we really need to have happen on this. And the research that's been put out to this point does suggest that promotion efforts from certain Republican political leaders could be beneficial. You know, one of the most important studies so far does demonstrate that having a video message from President Trump could be effective in moving intention to vaccinate among conservatives by up to about 7%. So certainly having certain Republican political leaders speak out is important. And in some of the work I do, we are arguing that, you know, having Republican champions from political elites talking about vaccination could be beneficial. But I think the important thing to recognize about that is that not all political leaders are going to be equally influential, right? Certainly someone like President Trump, who's seen as the leader of the political party, and many individuals identify themselves as Trump supporters, that could be a far more effective message than, let's say, a message from Mitch McConnell, right? So it really depends on who that Republican political leader is. And sometimes it might not be a national political leader that's going to matter. It might be the local political leader in your community or someone like your governor. For example, having Ron DeSantis come out in favor of vaccination or having Greg Abbott in Texas speak more commonly about vaccination, those could be important. So what's important to recognize is, yes, President Trump has been vaccinated, and yes, he's made some positive messages about vaccinating, but he's been pretty quiet on that front compared to, you know, the frequency with which he was in the media when he was president, which on the one hand makes sense, but we would want people the right to be promoting vaccination very regularly. So certainly that's one strategy. Another thing to recognize is that messages promoting vaccination from the Biden administration could actually hurt, which is to say that people are going to see, if you're a Republican, you're going to see messages coming from Biden and parts of the government as messages from the out party. And you might not want to vaccinate just because you're being told by the people who weren't on your team that you should be vaccinated. The last thing, and this is something that's pretty common in the literature, is to say, regardless of what's going on the political side, what really matters is messages from trusted members of your community, right? So having someone that you trust and that you have built a relationship of trust with tell you to vaccinate and to treat you with respect as you learn about why they might be concerned is going to be the most important thing you can do to convince someone to vaccinate. So maybe it's actually having people at the local level, like local religious leaders, having people at the local level, like local public health leaders, various other community leaders could be critical to convince others to vaccinate.
I just find it so hard to believe, like when you said that if the Biden administration says get a shot, a conservative might say, well, no way, because that's who told me to do it. How can we, I'm having trouble getting my mind around, like, how can we be risking our health because of political partisanship?
Yeah, and it's a really hard thing for people in public health who just think, well, we got to do what's best for public health to wrap their minds around. But it's actually something we see quite often on the political side, right? On the political side, everything is viewed through the lens of winners and losers, right? And for better or worse, in the United States, many Americans have internalized their political party identification as part of their sense of self, as part of their identity. So if you're getting a message from someone else on your team to do something, and when I say team, I'm not thinking about this, but this is how we think about it in terms of identity. If someone who shares the same identity with you tells you to do something, you're going to be likely to do it. But if someone who has an opposite identity to you is telling you to do something, you might be less likely to do it, which is why, on the one hand, we want key pieces of the federal government, like the CDC, to be promoting vaccination. But as soon as those messages get tied to Democratic political leaders, you could have severe backlash effects and consequences from sort of that boomerang of, well, it's actually coming from the person who I voted against. Why would I believe them? I'm going to listen to what I'm hearing, for example, from right-wing media figures who I trust.
This is so hard, really, to hear, but I know it's the reality. Given this incredible amount of vaccine hesitation that seems to have come out of nowhere, really. I mean, I know there were seeds of it, but this has really exploded. What are the implications for the future of vaccine preventable diseases? I mean, are we going to see fewer people getting their childhood immunizations than before? And are we going to see a real problem going forward? Should we encounter another pandemic?
I think that is one of the biggest concerns we have right now. In the space of individuals who study vaccine hesitancy, this is one of the big concerns, right? So before the pandemic, most Americans were willing to vaccinate themselves and their children against various vaccine preventable diseases. Was there vaccine hesitancy? Absolutely, especially around the MMR vaccine, but there was some degree of vaccine hesitancy in the American public. And most of those individuals who were vaccine hesitant before COVID-19 are still vaccine hesitant. The big concern is that a big chunk of Americans who are traditionally trusting of vaccines are now hesitant to vaccinate against COVID-19. And the question becomes, if you've internalized not vaccinating as part of your sense of self, as part of your identity during the course of this pandemic, are you then 3 years from now, if you have a child, going to have your child vaccinated against all the vaccine preventable diseases you would want a child to be vaccinated against? And that is the big concern we are working against. We need to make sure that individuals who are vaccine hesitant against COVID-19 are not coupling that with vaccine hesitancy against all vaccines. So we need to be doing everything we can to decouple those, because the reality is we are not that far away from hitting or from dropping below herd immunity thresholds on various vaccine preventable diseases. The one that stands out immediately is measles. We had various measles outbreaks happening right before the COVID-19 pandemic in 2019. We had a measles outbreak in Washington State and in Texas and in parts of New York. And you could very easily see a world where if vaccination numbers drop a few percentage points because we have more vaccine hesitant individuals, we could have new vaccine preventable diseases start to emerge with a vengeance that we have to deal with. And that puts even more strain on our public health infrastructure that could still be dealing with COVID-19.
Mm-hmm. So how can we be better prepared for next time?
Well, I think the first thing we need to recognize is politics matters, right? I think within the public health, we always are just thinking about doing what's good for public health, but we need to recognize that when we're training the public health workforce to work at places like the CDC, when we're training, people who are going to be working in various aspects of government, that health and government are necessarily going to be interacting. And we need to make sure that they're interacting in a way that's not going to lead to partisan conflict. Because as soon as partisan conflict is in play, you could start to see the politicization that we've seen related to COVID-19. So we need to find ways to make sure that as health interacts with government, it's doing so in a way that's promoting public health without creating that partisan conflict that can be so problematic. So I think that's the single most important thing we can be doing. Now, beyond that, I think we need to be investing considerably into understanding strategies to reduce vaccine hesitancy and the politicization of science more broadly. We've seen the politicization of science sort of take off with a vengeance over the past decade, related to climate change, certainly, but now related to vaccination. And unfortunately, we don't have nearly as much research on trying to depoliticize things as we would like. And part of that is we don't have that many experts who are interdisciplinary in the sense of looking at the social and the psychological and the political and health all at once. Another piece of this is that historically, the NIH hasn't wanted to fund politically focused research, and the NSF will look at health focused research and say, send it to the NIH, right? So there's not this true space where if you want to study this politicization for you to go. So we need to be finding new mechanisms for social scientists to get funding so we can understand that. So if we do have politicized issues in the future, we can address them quickly and head them off at the pass.
Timothy Callahan, this was so interesting. Thanks so much for joining me.
Happy to be here. Thank you so much.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.